Hello and welcome to the inaugural podcast of UNC Children's Hospital, coming to you from Chapel Hill, North Carolina. UNC Children's is a major referral center for children with complex conditions and consistently is recognized by U.S. News and World Report as one of America's best children's hospitals. Our nearly 200 physicians, our clinical research faculty, at the UNC School of Medicine. Their medical expertise spans nearly 50 programs in the School of Medicine's 20 clinical departments, including 14 divisions in the UNC Department of Pediatrics. UNC Children's Hospital has 150 inpatient beds and a comprehensive children's outpatient center located in the same building, enabling your child to see multiple specialists in a single visit. Today, the UNC Children's Podcast is very pleased to have as our guest Dr. Benny Joyner. Dr. Joyner is Division Chief, Pediatric Critical Care Medicine, UNC School of Medicine and Department of Pediatrics. And now to today's topic. Recently, a common respiratory virus began spreading at unusually high levels throughout the United States, overwhelming children's hospitals in many areas. That disease is RSV, and it's a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but it can be serious, especially for infants and older adults. RSV is the most common cause of bronchiolitis and pneumonia in children younger than 1 year of age in the United States. So, Dr. Joyner, thank you very much for being here with us today on the UNC Children's Podcast. I know you've been very gracious enough to talk with a number of media outlets across the state and the nation about RSV over the past few weeks. To help educate the public on what to look for and if a child is experiencing respiratory disease symptoms. Could you explain for our lay audience, our moms and dads, what is RSV?
Yeah, thanks so much, Phil, for having me. And I think this is a very timely time to have this podcast. It's a very timely topic, especially given the fact that RSV, or respiratory syncytial virus, is really, raging, not only through our local area here in the Triangle and in Chapel Hill, but also, in our region in the Southeast and nationally. And what we're seeing is that RSV, respiratory syncytial virus, is a virus that oftentimes in adults and older kids may cause the signs and symptoms of a cold. So you may have a cough, a runny nose, a fever and headache and malaise, or just fatigue in general, just feel run down, and just, attribute it to a common cold. And I'll just, take some Tylenol and maybe get some rest and drink some orange juice and I'll feel better. I think the challenge is that with RSV specifically, it creates a lot of mucus production. Anybody that's ever had a cold from RSV probably recognizes the constant need to either clear your throat or to blow your nose, just to clear your airways. And so, as you can imagine that, now take that and move that into a child that's 6 months, 8 months, a year old, 2 years old, that isn't able to cough effectively, isn't able to blow their nose like you or I can. And also remember, take those airway passages and really shrink them down and really put them into an infant. And you combine that mucus production and that small airway and inflammation that comes with being infected, and you really have just a perfect recipe for causing really significant respiratory distress. And that's what we're seeing in our infant and toddler population. Children coming in with really difficulty breathing, really working hard to breathe because they're unable to either clear their airways or unable to just pull in the amount of air that they need. And a lot of that's due to some of the swelling that occurs during the inflammatory process in children.
Many of our audience members probably have not heard of RSV until recently, if at all. This is not a new virus in humans like COVID-19, is it?
No, it's not. And, we have seen RSV for as long as I've been in training, and it predates, before I was in training, because I haven't been in training. I wasn't in training that long ago, or at least I'd like to think that of myself, but we've seen it, and it used to be a pretty predictable pattern. It's the ailment that commonly causes illness in infants and toddlers, especially during the winter months. We know that there's certain populations that are at increased risk, those that are, premature, and those that are 6 months of age at the time of RSV season hitting. And so we've developed therapeutics to address that. So it's been around, and, pre-pandemic, it was significant, but we could manage. We were able to sort of predict with fairly good certainty, like how bad the season's going to be. But over the past couple of years, it's really, for really unclear reasons, it's really gotten significantly worse in terms of the number of patients that we see coming in with significant respiratory distress. And that is where I think we're significantly challenged, is just the sheer numbers of patients.
Now, if this is a common virus and it's been around before, why do you think RSV is seemingly breaking out across the U.S. right now? Is there any relation to COVID-19?
That I think there are a lot of people looking into this. Many people, here at UNC, many people abroad and nationally. I think that's a really difficult question to answer, Phil. I think that there are many hypotheses out there about what it could be, but really, I think the bottom line is going to be that it's not going to be any one thing. I don't think it's a particularly virulent strain of RSV, or a particularly, deadly strain of RSV, as it were, because the symptoms that we're seeing in our patients are the symptoms that we typically see in patients. We're just seeing more patients. And so it may be that they haven't been exposed, to RSV historically, and now they're getting exposed now.
Well, that was my next question, actually. So we've heard some doctors and some researchers theorize that RSV is spreading so rapidly and broadly because the COVID lockdowns prevented children's normal exposures to various viruses and bacteria, just that they, build up immunities because they're exposed to it at school, with play dates and whatnot. And then after that, more than 2 years of social distancing, and as restrictions were being eased, that children are being exposed to these pathogens, and that might account for the current surge. What are your thoughts on that?
Yeah, I think that's as good as explanation as any. I mean, it's timely. It makes sense. It follows, from our social distancing. You have to explain patterns here. I think the challenging thing is that this is not necessarily a U.S. phenomenon, though. This is, not necessarily limited to, North Carolina, to California, to Missouri. This is globally. I was talking to a colleague, located outside of the country, and they're experiencing similar, or they had experienced similar shifts in timing of RSV infection and severity. And in their particular location, they didn't have nearly the level of social distancing that we had initially implemented with our lockdowns. And so I do think that there's some truth to the lockdown. I think that it certainly contributes, but I struggle with saying that's the full answer, because if that were the full answer, I do think there would be certain populations that would also be doing a lot worse. I will say for kids with pre-existing conditions that haven't been exposed, I do see that those kids, I think, come in a lot sicker, and that may be due to this exposure theory.
Now, as we're recording this podcast, it's fall, and then winter is quickly approaching. Everyone's everybody's moving back indoors, and then you add to that the relaxation of social distancing, mask requirements from the pandemic, and then we're told to expect another surge in COVID-19 cases. How can parents distinguish between just the sniffles or a common cold and something that might be life-threatening, like RSV, or is RSV life-threatening?
Well, certainly RSV can be life-threatening, and that's why many patients are hospitalized. That's why, our intensive care unit here at UNC is half filled with patients with, RSV, because they require such a high level of support. I do think your question is an important one, and it's a tricky question, because it is extremely challenging to distinguish COVID-19 and RSV infection, even among seasoned practitioners like myself, who have gotten fooled thinking it's one, and it turns out to be the other. This looks like COVID. Oh no, it's RSV. With another super infection, or it's COVID. Oh well, I could have sworn that was RSV or rhinovirus. And so I think it's very challenging. So the really only way to definitively determine whether or not you have RSV or COVID is through testing at your local medical provider, whether that's at your pediatrician's office, urgent care, or emergency department. I will say,
Right.
coming to the emergency department will be challenging though right now, because again, I think to your question, how do you recognize the differences? How do you recognize someone is sick or not sick? I think is going to be really important, and you should really reserve coming to the emergency department for someone who's
Right.
really ill.
A lot of the media coverage that we've seen this year in 2022 is focused on children with RSV, and that's obviously what we're talking about with UNC Children. But overall, is it as dangerous for older Americans as it is for kids?
I think anytime an older adult gets a respiratory ailment, I think that is pretty significant and pretty challenged. There is a potential for the inflammatory process to do significant damage, to the airways, which could compromise an older adult that may have less reserve or resilience than a younger adult would. So I will say that there are concerns, but again, in general, RSV disease is less deleterious to adults than it is than for children. I mean, it is, kids really get gobsmacked with this and really get taken down. And so I think that is really a particular challenge.
Is there, is there a vaccine for RSV?
There is, and it's approved for limited populations, and so that was the what I was alluding to. It's a prophylaxis called Synagis that is available to certain infants that are premature and who will be of a certain age during RSV season. So if you have a premature infant, or you should speak with your pediatrician, about the Synagis vaccine.
Just this week, we were seeing news stories warning the U.S. to beware of a triple threat of respiratory diseases this winter: COVID, flu, and RSV. Is there evidence that leads you to believe that these three diseases will create the perfect storm of respiratory sicknesses?
Yeah, I will say that what is going to be interesting to see is how COVID, as it's mutated over the years, how deleterious it will be and its impact on adults. Because what we've been fortunate with, I think, if we can even use that term, is that, during the first waves of COVID, it really impacted, our adult colleagues in a very detrimental way. It was extremely fatiguing. It taxed their resources beyond what we could do, and we saw evidence of that. What was the saving grace at that moment was that the pediatric impact was not nearly as significant, so we could step up to help, and there could be resources available that were normally allocated toward a bad respiratory process in pediatrics or in children that could be then redirected toward adults. And in each subsequent wave of COVID, we've seen some ability to do that. While yes, there were increasing impacts on kids, it wasn't nearly the level that it was adults. And I think what we're seeing now is a flip that, not necessarily COVID, because our COVID numbers still remain, remarkably low. And I hear that the triple demic, or whatever it's called, I hear that term. And what we're facing right now is certainly our influenza rate has doubled over the past week. Our RSV rate is still sort of at these sort of historic highs. And as we enter the winter months, just as you described, I do worry that with this more contained, less distanced, and less masked environment, COVID is going to start to spread. So then what we're going to see is the adult system gets stressed again. So you'll have the pediatric and children's system stressed, and then you'll have the adult system stressed. And I think the combination of those stressors will create a really horrific, in my mind. It really, I shudder to even think about it, Phil, to be completely candid with you. Like, I've been grateful that we've always had one or the other. Like, even during this, as bad as it is right now, I'm like, my adult colleagues are able to assist, they're able to help out, and they're not feeling the strain quite nearly as much as they were. So I'm grateful for that. But if they start to see COVID again, and here we are with both adult and peds now stretched at their max, I worry. I really do.
Well, that was kind of my next question. A couple related. One, is it possible for a patient, child, or adult to get COVID-19 and RSV at the same time? Have you seen that?
There's nothing that would prevent that, and I'm just sort of reflecting. I think I've seen a patient with COVID-19 and RSV. I can't quite be certain. I have to go back and take a look at my records, but I'm pretty sure we've had at least one, if not more than one, patient with COVID
Right.
and RSV in our unit. So there's nothing that would prevent them from having both.
Right. What's it like inside UNC Children's hospitals these days? Has the spike in RSV caused you to make changes in how you care for your other pediatric patients?
Yeah, it's caused us to make some really challenging decisions. I think that as I was explaining to someone else earlier, as RSV ramps up, as the number of cases climbs higher, there are still what I call the background patients, the other patients that still need our care, that still get sick. There are other disease processes happening. There are other surgeries that need to happen. There are other injuries, traumas that occur. And so what ends up happening is that we start to make some of the same challenging decisions that were being made, during COVID about the timing of care. Like, is it the right time to have this elective surgery performed right now, given our capacity constraints? Are we able to take this patient here at UNC, or do we need to redirect them? How do we provide this necessary life-saving chemotherapy to patients that normally is provided in an inpatient bed, but because we don't have an inpatient bed, we have to then come up with other alternatives. We need to get people treated for seizures, and how do we do that safely? So we've had to change, and we've had to pivot our model, and it's not all been for the better.
Do you think this is a one-time or a rare event, or do you expect to see similar outbreaks in the future?
You're really coming with the easy questions, Phil. I don't think that this will be a rare event. But I don't. My hope is that this isn't the new norm. I don't think that this will be the new norm. But I do not think that this surge, this wave will pass quickly. I do think that we'll see these historic numbers for a period of time. I'm hopeful that we've plateaued for a bit, and maybe we'll level off. But as the winter comes, we'll rise again, and then I think that we'll be in for at least my sense of it is a couple years of this. I mean, when we first came out of the pandemic, we sort of anticipated a real rush because kids weren't in school, they weren't together, and that's anybody who's sent a child to daycare knows the best way to get a child sick is to send them to daycare. And so we knew that once those that type of operation opened up again, that we would be seeing some increased numbers. But I think what we've all been caught off guard with is the height of the peak.
Great. Well, that is all we have time for today. Our thanks to our subject matter expert today, Dr. Benny Joyner. Thank you, Dr. Joyner, and thank you, our audience, for joining this podcast from UNC Children's. We hope you'll subscribe and join us for future shows. Thank you for your interest in UNC Children's Hospital. For more information, please go to UNCchildrens.org. Thank you so much.
Thank you, Phil.